नेक्स्ट इंपॉर्टेंट शॉर्ट नोट जो जनरल एनाटॉमी में पूछी जाती है, दैट इज द साइनोवियल जॉइंट. ये कभी कभी एज अ शॉर्ट नोट एंड समटाइम एज अ लॉन्ग क्वेश्चन, और इसमें से कुछ पार्ट्स सेपरेटली आस्क्ड एज अ शॉर्ट नोट. Whenever there is a short note on synovial joint, what you have to write? What is synovial joint? What is structure of synovial joint? That you have to explain in detail, okay, along with the diagram of the synovial joint, okay, and how does this synovial joint is formed, and then the types of the synovial joint with examples, or further classification of synovial joint. Basically this topic is in 3 parts, okay. First, these 2 parts we will focus. What is mean by synovial joint and what is the structure of the synovial joint, okay. So what is the definition of synovial joint? Synovial joint is the joint which has a cavity in it called as a synovial cavity, okay, which consists of a fluid in it called as a synovial fluid. So it is a type of joint where 2 bones are held together by a fibrous tissue that is called as the fibrous capsule, and between these 2 bones there lies a cavity that is called as a synovial cavity, which is filled with a fluid that is called as a synovial fluid. Such a structure is called as the synovial joint. So synovial joint are freely movable type of joints, and that's why they are called as a diarthrosis, okay, as they are the freely movable. So what is synovial joint? It is the joint where the 2 bones are connected by connective tissue called as a fibrous capsule, and between these 2 bones there is a space that is called as the synovial cavity, which is filled with the synovial fluid, okay. So that is, so what is the synovial joint हमने explain किया. Then you have to draw the diagram. So this is the end of the one long bone, okay, which is covered by this cartilage, okay, that is called as articular cartilage. This is the other end of the long bone, okay, which is covered by the articular cartilage, okay. Then these 2 bones are connected by this fibrous tissue, okay, that is okay. And then there lies this red color is the synovial membrane, and which consists of this synovial fluid in it, okay. So that is the main structure of the synovial joint. So what comes in the structure of the synovial joint? That comes the next part, structure of synovial joint, okay. आपको ये डायग्राम ड्रॉ करनी है जो हमने यहाँ पे ड्रॉ की, ओके. देन विच आर द कंपोनेंट्स ऑफ द साइनोवियल जॉइंट इन स्ट्रक्चर. सो फर्स्ट आता है फाइब्रस कैप्सूल दैट कम्स इन द साइनोवियल जॉइंट. देन फिर आता है ओवर दैट फाइब्रस कैप्सूल लिगामेंट्स, ओके. अपार्ट फ्रॉम द लिगामेंट्स, ओके, देयर लाइज द साइनोवियल मेम्ब्रेन, और उसी के साथ आता है साइनोवियल फ्लूइड विच लाइज इन द लाइन्स इट, ओके. फिर आता है आर्टिकुलर कार्टिलेज दैट आर नथिंग बट द एंड्स ऑफ द बोन्स विच आर कवर्ड इट. एंड फिर 2 जॉइंट के बीच में, कैविटी के बीच में समटाइम्स देयर लाइज आर्टिकुलर डिस्क, और विच इज ऑल्सो कॉल्ड एज द मेनिस्कस, okay. And apart from that there is a fat and there is a bursa that also comes in the minor part. So main part is the fibrous capsule. Around the fibrous capsule there lies the ligaments, then synovial membrane and synovial fluid, what its function, then articular cartilage which surrounds the ends of the bone taking in the synovial, and articular disc sometimes present in which some joints that divides the cavity into a different parts. Now one by one. First is the fibrous capsule. What is fibrous capsule? Fibrous capsule is the made up of the connective tissue, okay, and that connective tissue holds the articular bones together, okay, that is called as the fibrous capsule. So this fibrous capsule, what it's, these two bones are held together by a one fibrous or white fibrous tissue, and that is called as the fibrous capsule that encircles the articulating ends of these two bones, okay, that is what is the function of the fibrous capsule? Hold these two bones together, prevent their departure, dislocation, that is the second function. This fibrous capsule having a richly supplied by nerves, which is richly supplied by nerves, and when these nerves are get stimulated, the part of the fibrous capsule gets stimulated, it also stimulates the muscles nearby for the contraction, and then it will lead to the movement at the joint, and in this way it gives the or make the joint in an optimum position to make the capsule relax and prevents the painful movement at the joint. So it acts as a watchdog like action of the capsule. So which part of the synovial joint act as a watchdog action? That is the fibrous capsule that asks in the MCQ. That is the first part. Second part is called as the ligaments. So what is ligaments? These are the supporting framework. Apart from the fibrous capsule, the two bones are held together. These two bones are, that is the with the help of the ligaments. In ligaments there are two types of ligament. One is true ligament and other is the accessory ligaments. So what is true ligaments? They are nothing but the thickening of the fibers of the fibrous capsule, and they are mainly derived from the fibrous capsule. These are called as the true ligament or intrinsic ligament. They are nothing but the extensions of the fibrous capsule. What is accessory ligament? These are the they are the fibers or the separated from the fibrous capsule, or they are nothing but the extension of the muscles or the tendons of the muscles which lies around that joint. They are called as the accessory ligaments. So that comes the second part, accessory ligament. And whenever there occurs the sprain, which part of this structure of the synovial joint get injured? These are nothing but the ligaments, they get injured, okay. Third, synovial membrane. What is synovial membrane? It is a thin transparent membrane which lies inside the joint cavity or inside the fibrous capsule, okay, all over the inside part of the synovial joint. This red color is covered by the synovial membrane except the ends of this bone where the articular cartilage is there. So except the articular cartilage, from inside surface of the fibrous capsule is covered by the synovial membrane. What is the function of synovial membrane? It secretes the synovial fluid, okay, and that is act as the main lubricant for the synovial joint or act as a main lubricant in the synovial cavity. So that is the function of the synovial membrane, okay. Then the next comes the articular cartilage. What is articular cartilage? It covers the ends of the bones. ये जो दो बोन है इनके ends को वो cover करता है, and so that these ends become smooth and avoids the friction in during the movement of the joint. And they are mainly which type of cartilage? Haline cartilage. So articular cartilage is haline cartilage. So provide smooth frictionless movement and resist the forces, okay. That is articular cartilage. Next is the articular disc. Some joints, okay, suppose this is the joint, some joints is having a some cartilaginous structure between these two ends of the bones, okay, and in this synovial cavity, and that divides the cavity into two compartments, above it and below it. This disc is called as a articular disc. So different movements occurs in upper compartment and lower compartment, and that is also called as a meniscus. So articular disc function, it helps in the lubrication. It divides the cavity into two compartment. Okay, so it prevents some wear and tear of these articular cartilages by providing the cushioning effect. That is the main function of the articular disc. Okay, so these are the main components of or the structure of the synovial joint. Okay, then next comes the classification or the types of the synovial joint. Okay, now there are the two ways we are classified it according to the structure or according to the function. Now, in classification, we classify it in different ways. So, first, according to the number of bones taking part, that is the one way of classification of the synovial joint. According to the movement planes or the axis of movement, okay, that is the one way type of classification. According to the structure of bone taking part in a joint, okay, that is the one way of classification. So that is nothing but the how the shape of the articular surfaces is. Okay, so according to this shape, they are either plain synovial joint, they are either hinge synovial joint, they are either pivot type of synovial joints. Okay, then they are either ellipsoid type of synovial joint, they are either saddle type of synovial joint, or a ball and socket type of synovial joint. These are the different types of the synovial joints. According to movement, no axis, non-axial type of synovial joint. Then they are either uni-axial type of synovial joint, they are either biaxial type of synovial joint, and the multi-axial type of synovial joints. And according to the number of bones, they are either simple synovial joint or either compound synovial joint and either complex synovial joints. One by one, we are going to see. This non-axial or they are either plain synovial joint. Uniaxial will come hinge and pivot type of joint. Biaxial will come ellipsoid and saddle, and multi-axial is a ball and socket type of joints. Okay, so no axis of movement, plain synovial joint. Uniaxial will come either hinge or the pivot variety. Okay, hinge or pivot variety. There comes to the uniaxial. In biaxial, movements occurs at two axes. There are either ellipsoid and salad type of variety, and multi-axial will come and ball and socket type of variety. Okay, one by one, these two are we take collectively. So first, no axial type of, so their movements occurs or there is no axis of movement, so there occurs only a slight movement, that is called as the gliding movement or frictional movement will occur. Okay, the first joint in is the plain synovial joint. So what do we mean by plain synovial joint? The articular surfaces are the flat. So this is one bone and it is having this flat articular surface, and this is the another bone in which this flat articular, so there occurs movement, only gliding type of movements possible. Okay, this type of joint is called as the plain synovial joint. So articular surfaces are flat and only side to side movement or gliding movement or only back and forth friction type of movement will possible. This type of joints are called as a plain synovial joint. What are the examples of the plain synovial joint? The joints between the carpals, intercarpal, joints between the tarsals, intertarsal, the joint between intermetatarsals and intermetacarpals, joint between the articular process of adjacent vertebrae, that is between the two vertebrae adjacent. That is also example of plain synovial joint. Okay, another few examples, these are important from MCQ point of view, is the interchondral joints of the fifth to ninth rib. Okay, costovertebral, costotransverse joint, acromioclavicular joint. Okay, sacroiliac joint. Okay, all controsternal except the first. Okay, these are the few other examples important from the exam point of view. So plain synovial joints, which are the example: intercarpal, intertarsal joints, intermetatarsal joints, intermetacarpal joints. Okay, joints around the vertebra, so joints between the articular process of vertebra: costovertebral joint, costotransverse joint. Apart from that, acromioclavicular joint. Okay, then controsternal joint except the first, and the sacroiliac joint. These are the examples of the plain synovial joint. Second type of joint is called as a hinge synovial joint. Hinge synovial joint, okay, the articular surfaces are like a pulley. Okay, for example, like a hinge of any door. Okay, so this is the hinge of any door, and when it like this movement occur, they move from here to here. Okay, same as the elbow joint. Okay, so there lies, this is ulna, and this is the humerus lower end. In it, this ulna fits, and this goes and this goes. So there is only one type of movement is possible, that is called as a hinge type of variety. It is also called as a gingivimus type of joint. One surface is like a pulley. Okay, like this curve, one surface is having a pulley and the other surface fits in it. Okay, so there occurs a movement at only one axis or one plane, and that is the transverse axis. There occurs movement only at a transverse axis. Okay, examples of a hinge joint are the elbow joint, ankle joint, and the interphalangeal joints. Elbow, ankle, and interphalangeal joints are the examples of the hinge variety. Okay, third type, that is a uniaxial. Apart from hinge, there occurs at only one axis, that is the transverse axis. Another joint is called as the pivot joint. This occurs around vertical axis. Movement occurs at one axis only, and that axis is vertical, in which there is one process, and around it other bone or the ring is there. Okay, and that rotates around, so there occurs rotatory movements. Okay, so articular surfaces of the one bone is a rounded structure, and which fits into the cavity of the another bone. Okay, that is called as a ligamentous ring or osseous ring, osseo-ligamentous ring. So one bone is having an axis or rod, and other part is having a osseo-ligamentous ring, in which the rod rotates or either ring rotates. Okay, example is the median atlantoaxial joint. Okay, in which the second vertebra is having a rod-like structure, that is called as a dens, and first vertebra acts as a ring where it rotates over this, so where the ring moves and the dens is fixed. Okay, and in the superior radioulnar joint, what is the head of the radius is like this. There lies the ulna over here. Okay, and there is a ring which surrounds this annular ligament. Okay, here what, there is ring is fixed. Okay, ring is fixed like this. Okay, and this head of the radius moves, so here the ring is fixed, but the head, that is the process, it is moving. that is a superior radio ulnar joint. So pivot type of joints are the two median atlantoaxial and the superior radio ulnar joint. Okay, this is the pivot. Movements occurs at one axis vertical, and hinge variety movements occurs at one axis but the transverse axis. Pulleys, the hinges of the doors. One is the pulley shape, and here one bone is as like a ring, and other is having a process. Fourth variety of synovial joint is called as a condylar, that we also call as a ellipsoid. Okay, ellipsoid type of joint. Okay, what is the surface are the elliptical. Okay, so it is having a convex surface of one bone articulates with the elliptical concave surface of the another bone. Okay, the movement are permitted at the two axes, so it is called as a biaxial. So there occurs flexion and extension at a transverse axis, and the abduction and adduction occurs at a antero-posterior axis. So like in the wrist joint, okay, radiocarpal joint, atlanto-occipital joint, metacarpophalangeal and metatarsophalangeal type of joints. Okay, this type of is a example of a ellipsoid type of a joint. Okay, then next example is the saddle. Next type is the saddle type of joint. Okay, where the articular surface are reciprocally concave or convex. Okay, so they are like a saddle, जैसे वो घोड़े के ऊपर रखा जाता है बैठने के लिए, that is also in a saddle shape. So one articular surface is at the one angle it is a convex, and if you see it side to side it is like convex. Okay, so it has both concave or convex type of surfaces. When this comes in a contact, they forms a joint that is called as the saddle type of joint. Okay, so what are the examples of the, this is very important, which joints are the saddle? There are only few examples. Is the first carpo-metacarpal joint, thumb, sternoclavicular joint, calcaneo-cuboid type of joint, and between the incus and malleus of the ear ossicle, incudo-malleolar joint are the example of the saddle variety. So first carpo-metacarpal joint, then there is a sternoclavicular joint, then there is a calcaneo-cuboid joint, okay, and incudo-malleolar joint. Okay, these are the examples of the saddle type of joint. Okay, where the surfaces are concave or convex reciprocally. ओके, एग्जाम्पल याद रखना, जो घोड़े के ऊपर रखा जाता है ना बैठने के लिए. ओके, दैट इज द सैडल टाइप ऑफ शेप. ओके, अगर हम साइड टू साइड देखोगे तो ये कॉन्केव दिखता है, और एंटेरो पोस्टीरियर देखोगे तो ये कॉन्वेक्स दिखता है. ओके, सो दैट इज द अनदर एग्जाम्पल, सैडल टाइप ऑफ जॉइंट. नेक्स्ट इज द ball and socket type of joint. So what is, one articular surface is having a ball shape, and other articular surface is having a socket shape. Okay, that is called as ball and socket type of joint. This is the multi-axial type of joint. Freely movement occur all axis टाइप ऑफ वर्टिकल एक्सिस, एंटेरो पोस्टीरियर. वर्टिकल एक्सिस में रोटेटरी मूवमेंट हो सकते हैं, एंटेरो पोस्टीरियर एक्सिस में एबडक्शन एडक्शन होगा, ट्रांसवर्स एक्सिस में भी मूवमेंट होगी. ओके, सो ऑल काइंड्स ऑफ मूवमेंट विल ऑकर. क्लासिकल एग्जांपल इज द शोल्डर जॉइंट and the hip joint. These are the freely movable ball and socket type of joint, and the joint between the incus and the stapes, that is called as incudostapedial joint, and calcaneonavicular joint, that is also an example of ball and socket type of joint, but these two are the restricted type of the ball and socket joint where no free movements and shoulder and hip joint where all kind of free movements are possible. That is called as the freely movable type of ball and socket type of joint. Okay. So these are the all classification with examples. Next one is the what is the simple synovial joint, where there are only two bones taking part in the joint formation, that is simple. What is compound type of synovial joint, where more than two bones are taking part in a joint. Their example is the either ankle joint, elbow joint, okay, wrist joint, where two or more bones are taking part. And the third one is known as a complex type of joint, where the joint cavity is divided by articular disc into two compartments, and the different movements occurs in a different compartment is type of the complex variety. Temporomandibular joint, sternoclavicular joint, knee joint are the example of the complex variety. Okay, so this is all about the synovial joint, its structure, definition, and the classification of the types of the synovial joint according to the axis, according to the surface forming the joint, and the number of bones, and each type what does it means, and there are the examples. That is the mainly asked in the viva, also in the MCQ. Okay, and also in the theoretically it is very important topic, synovial joints. सो दोस्तों, अगर आपको ये वीडियो अच्छे लगे तो मेरे चैनल को लाइक, शेयर और सब्सक्राइब ज़रूर करना। थैंक यू वेरी मच।